Thank you for joining me for Roseman University's 2025 State of the University Address. I would like to welcome our Board of Trustees, our faculty and staff, students, alumni, clinical and community partners, donors, elected officials, and friends joining this special live stream event. Your presence reflects the shared commitment that continues to propel Roseman University forward. As we gather just before the Thanksgiving holiday, we take a moment to recognize the progress we made together this year and look ahead with shared purpose. We achieved significant milestones, and we are grateful to the many individuals and partners who contributed to this work. And while we take pride in these accomplishments, we remain focused on the work that continues. To those who have supported our mission and to those who continue to stand with us as we advance new initiatives, thank you. Our shared commitment will continue to guide us. Roseman University exists to advance the health and wellness of the communities we serve by educating current and future healthcare professionals, conducting research, and providing patient care. This mission guides every decision we make as we grow and take on new challenges to respond to the needs of our region. Our theme this year, Advancing Together, emphasizes that progress happens through collaboration. Collaboration within the university and collaboration with external partners were hallmarks of the many achievements Roseman University realized this year. And collaboration will remain a foundational cornerstone as we build for the future. So let's take a moment to reflect on this year's accomplishments and achievements. In February, the Roseman University College of Medicine earned preliminary accreditation from the LCME and enrolled its inaugural class of 64 MD students, 20% of whom are Nevada natives. Although they come to us from different places, cultures, and with different life experiences, they share one intention: to improve the health and lives of people in their communities through service as physicians. At their white coat ceremony in July, we witnessed the beginning of their medical education and the realization of a commitment Roseman University has worked toward for more than a decade. Their presence represents more than the opening of a new academic program. It represents a shared effort to expand access to medical education and strengthen the healthcare workforce in Nevada and throughout the Intermountain West. This achievement reflects years of collaborative work, faculty and administrative leadership developing a groundbreaking character-based curriculum shaped by the needs of our region, clinicians and community partners providing clinical training opportunities, donors and supporters investing in the promise of a medical school committed to the principles of humility, excellence, and respect, and addressing the shortage of physicians in our state. The College of Medicine exists because our community believed in the impact it would have and worked together to make it real. Now, midway through their first year in the MD program, our medical students are engaging in the community through the Genesis Household Center Care Program. Genesis places students in teams that work directly with households across the Las Vegas Valley. Through this experience, students learn how social determinants of health, such as housing stability, nutrition, transportation, employment, and access to social support, shape the health and well-being of individuals and families. Students collaborate with care teams to connect households to resources that support stability, wellness, and long-term resilience. This approach extends to our Empowered program, which provides wraparound services and support to pregnant and recently postpartum women recovering from substance use disorders. Thanks to a grant support from Molina Healthcare, medical students now participate in household visits alongside clinical faculty and Empowered's peer recovery specialists. These experiences help students understand the barriers to care faced by families navigating recovery, and they see firsthand the power of dignity-centered, trauma-informed, relationship-based care. The first class is already shaping the educational culture of the College of Medicine and reflecting the ideals of a character-based curriculum rooted in service, professionalism, empathy, and respect for human dignity. When Roseman's medical students graduate as physicians, they will carry forward not only clinical knowledge and skills, but a deeper lived understanding of the realities their patients face. We thank our board of trustees, our university and college leadership, our faculty and staff, our healthcare partners, and the many donors who have believed in and supported our mission. And while the College of Medicine is now a vibrant reality, our need for support continues, especially support for student scholarships, to ensure that those who are called to serve as physicians are able to answer that call. In addition to its role in supporting the College of Medicine's curriculum, the Empowered program has expanded its geographical reach, serving hundreds of clients in Southern Nevada, Reno, and Carson City, as well as Davis and Weber counties in Utah. Recently, with support from the Fund for a Resilient Nevada, the program expanded into rural northern communities where access to care has long been limited. Moreover, the Empowered program's reach expanded through the launch of Empowered Go, a mobile and telehealth-based service model that enables the program to reach families where they are, bringing expertise, resources, and compassionate care directly into communities. The work strengthens maternal and infant health outcomes and supports the long-term resilience of families. It is a clear demonstration of how Roseman advances community health, not from a distance, but through presence, partnership, and sustained engagement. The work of the College of Medicine's programs reminds us that access to care means meeting people where they are. The same principle guides our efforts in dental education and clinical service, where we continue to expand capacity to meet the oral health needs of our communities. Just last month, we dedicated the Thorne Clinic for Integrative Oral Health and Primary Care at the Henderson campus, supported through the generosity of Stephen Thorne and the PDS Health. The 12,000 square foot clinic features 35 dental chairs and is adjacent to Roseman's existing dental and orthodontic clinics, as well as a new Roseman Medical Group primary care clinic scheduled to open in the coming months. With the addition of the Thorne Clinic, Roseman's Henderson campus expands its dental care footprint to 62 chairs and 17,300 square feet, with the capacity to provide up to 50,000 patient visits annually once fully utilized. The Thorne Clinic will serve as a key clinical education site for Roseman dental students. Beginning in early 2026, students enrolled in the Doctor of Dental Medicine program at our South Jordan campus will complete portions of their clinical training in Henderson, providing faculty-supervised patient care while advancing their didactic and clinical competencies. The number of students rotating through the clinic will continue to increase as we grow toward full clinical capacity in the years ahead. We extend our sincere appreciation to Stephen Thorne and PDS Health for their generosity and partnership, to the College of Dental Medicine and university's facility teams for their leadership in this expansion. Their work not only strengthens clinical education for our students, but also expands access to oral health care for the thousands of patients these clinics serve each year. Roseman's commitment to expanding educational opportunity continues beyond the clinic. At the Henderson campus, the Advanced Education in Orthodontics and Dentofacial Orthopedics program, in collaboration with the College of Graduate Studies, is preparing to launch the Master of Science in Dental Sciences degree. This new degree, which will be required for incoming orthodontic residents, creates academic and professional pathways in research, clinical education, and advanced practice. It strengthens the scholarly foundation of our orthodontic program and reinforces Roseman's role in preparing specialists who will lead in their field. At our South Jordan, Utah campus, the College of Dental Medicine continues to grow. The program is completing its significant academic transition from a 4-year to a 3-year Doctor of Dental Medicine program as it prepares to graduate its final cohort of 99 students in the traditional 4-year program in April 2026, while also preparing to graduate its first class of 102 students in the accelerated 3-year program. This transition was made with the intent of providing a high-quality education in a shorter period of time, permitting students to enter the profession 1 year earlier while reducing overall student debt. With an annual tuition that's comparable to the annual tuition of other 4-year programs, a Roseman University dental student realizes a 25% reduction in the cost of their degree, along with a 25% reduction in time to degree, thus making Roseman University's DMD one of the most affordable programs in the region while still maintaining educational quality. Our dental students continue to serve the community in meaningful ways. Through partnerships with organizations across the Salt Lake Valley, students provide dental education, preventative services, and compassionate care to individuals and families who may otherwise face barriers to treatment. With the ongoing support of Marathon Petroleum, the Give Kids a Smile and Back to School Brush Up events this past year provided free dental screenings and cleanings to hundreds of children in Utah. And these students also received vouchers to return for free comprehensive exams and cleaning and $100 toward additional treatment, helping ensure that children in our communities can learn and grow with healthy smiles. So far, in 2025, Roseman dental students have participated in 25 community service initiatives benefiting 5,500 individuals and providing nearly $1.2 million in value of care. This also equates to just under 9,000 volunteer service hours. This work reflects the heart of Roseman's mission to educate healthcare professionals while improving the well-being of the communities we serve. These dental students are not only preparing for successful dental careers, they are already making a difference. The College of Pharmacy continues to thrive and innovate in a healthcare landscape that is rapidly evolving. Pharmacists today serve not only as drug therapy experts, but as essential members of interprofessional care teams who support patient education, chronic disease management, and medication safety across care settings. A prime example of interprofessional collaboration is the grant that the College of Pharmacy secured from Kroger. This grant supports collaborative efforts between the College of Pharmacy faculty and the College of Medicine's Genesis Household-Centered Care program. Through this partnership, pharmacy students and faculty are delivering community-based education and resources for diabetes prevention and management, as well as heart disease risk reduction. This work equips Genesis families with tools to understand and improve their health, while preparing pharmacy students to serve as trusted health educators. Over the past year, pharmacy students in Henderson and South Jordan have participated in 87 on- and off-campus community health fairs and education events across Nevada and Utah, engaging directly with more than 1,500 patients to support wellness, chronic disease prevention, and medication literacy. Pharmacy students have also provided more than 12,000 immunization and counseled more than 15,000 patients at their practice sites. As a result of their education and community engagement, our latest class of pharmacy graduates achieved an 81% residency match rate, entering programs at hospitals and health systems in Nevada, Utah, and across the country. The College of Pharmacy's continued commitment for innovation, community service, and professional preparation reflects Roseman's mission at work, advancing health and improving lives. The College of Nursing continues to play a vital role in preparing the nursing workforce for our region and beyond. The college offers nursing education pathways from the Bachelor of Science in Nursing to the Doctor of Nursing practice, supporting nurses at every stage of their professional development. Our accelerated Bachelor of Science in Nursing program, with both on-ground and hybrid on-ground pathways, shortens the time to degree and thus entry into the profession, while maintaining high standards and producing highly competent entry-level nurses. While our Doctor of Nursing Practice, Family Nurse Practitioner, and Doctor of Nursing Practice, Nurse Anesthesia programs prepare advanced practice leaders who deliver specialized high-impact care. The nursing profession continues to evolve, and so does our approach to nursing education. The college is positioning itself for strategic growth, expanding its clinical training partnerships to ensure students have access to a diverse range of practice settings and patient populations. These partnerships strengthen the competence, confidence, and readiness of our graduates as they enter a healthcare environment that demands both clinical skill and adaptability. As we prepare future physicians, dentists, pharmacists, and nurses for our region, Roseman has taken up the challenge to address another growing workforce need: the need for veterinary professionals who support the health of animals, families, and communities. Early this year, Roseman University announced our intent to launch a College of Veterinary Medicine in Henderson, offering the Doctor of Veterinary Medicine degree. An important step toward the development of the college was the appointment of Dr. Catherine Fogelberg as the founding dean. Dr. Fogelberg brings experience in small animal general practice, urgent and emergency care, and zoo and wildlife medicine, along with academic experience in public health, veterinary education, and organizational leadership. The need for veterinary education in Nevada and the broader Western United States is significant. The West is considered a veterinary care desert, with fewer veterinary schools relative to population and geographic size. Several Western states, including Nevada, Wyoming, Nebraska, New Mexico, Idaho, North Dakota, and South Dakota, have no veterinary medical school, meaning students must leave the region to be trained, and many do not return to practice here. Even on a national level, the shortage of programs creates a barrier for prospective students. Last year saw a record 12,310 applicants to veterinary schools with only 5,200 seats available. Moreover, a recent study by Tripp Umbach demonstrated a need for an additional 1,600 new graduates by the early 2030s. In Nevada, 1.22 million households own more than one pet, but the state has fewer than 800 licensed veterinarians, placing it among the bottom 10 states in the nation for veterinarians per population. Of those practicing, most are located in the greater Las Vegas and Reno areas. Yet even these urban areas report ongoing challenges in access to veterinary care, especially for low-income families, shelter organizations, and unhoused individuals with companion animals. Rural communities face even greater gaps, particularly in livestock and mixed animal medicine. These shortages have measurable consequences. When veterinary care is difficult to access or afford, animals live with untreated pain and disease. Families may be forced to surrender the pets that they love. Sick or injured livestock may not receive timely treatment, affecting food supply and agricultural operation. Delays in care increase the risk of disease transmission, posing public health risks that extend well beyond animal health alone. The proposed College of Veterinary Medicine will be built on a One Health framework, recognizing the interconnected health of animals, humans, and the environment. It will leverage interprofessional education across our existing colleges of medicine, pharmacy, dental medicine, nursing, and graduate studies, and will utilize a hybrid distributive clinical training model in partnership with practicing veterinarians, shelters, ranches, and wildlife and public health organizations across the Nevada and the Western region. This model allows students to train in real-world settings, urban, rural, companion animal, production animal, equine, and shelter medicine, while strengthening care access in communities that need it most. As we work alongside our partners in the community, the College of Veterinary Medicine represents a strategic, mission-aligned expansion of Roseman University. It responds to regional workforce shortages, addresses community health needs, supports animal and public well-being, and ensures that talented students from Nevada and the Western United States can be educated in the region for the region. It is a clear expression of who we are as a university, advancing together where our communities need us most. As we expand into veterinary medicine to meet regional workforce needs, we are also strengthening the way that we prepare students across all health professions. That preparation depends not only on strong curricula, but on state-of-the-art environments where students learn and practice together. Today, I'm proud to announce that construction will soon begin on a new state-of-the-art Roseman University simulation building, which will become a centerpiece of the Summerlin campus. This 80,000 square foot, 3-story facility will embody the most advanced national standards in simulation-based education, integrating evidence-based design, cutting-edge technology, and highly flexible learning environments. The simulation building is intentionally designed to prepare our students across all professions for real-world clinical practice. It will feature a comprehensive simulated hospital with ICU, medical surgical, trauma, and labor and delivery suites, 2 operating rooms, a fully functioning outpatient OSCE center with 25 exam and multipurpose rooms, specialized skill and health assessment labs, digital anatomy spaces, a simulated home environment, and even a multi-station retail pharmacy where learners will practice workflow, patient counseling, and community-based care. The building's design promotes authentic team-based learning with integrated spaces for interprofessional scenarios that mirror the full continuum of care. Natural light, advanced circulation planning, fully equipped backstage areas, and flexible multi-purpose rooms ensure efficient operations and high utilizations. And with classrooms, student collaboration zones, faculty office suites, and a conference center overlooking the future campus quad, the facility will serve not just as a training center, but as a vibrant academic hub for the entire university and our community. When completed, the simulation building will stand as one of the most sophisticated training centers of its kind in the region, strengthening our ability to educate highly skilled, practice-ready professionals and further defining the Roseman Summerlin campus as a home for excellence in medical and health sciences education. As we invest in the environments where students learn and practice, we are also expanding the scope of how we generate new knowledge to improve health. That commitment is reflected in our growing research enterprise. This year, Roseman University earned the 2025 Carnegie Classification designation of a research college and university. Our faculty and students are contributing new knowledge in biomedical science, pharmaceutical research, clinical innovation, and population health. This recognition strengthens our ability to secure external funding, attract research collaborators, and provide meaningful research experiences for our students. It reflects not only the quality of our academic programs, but our deepening role in advancing research that improves health outcomes. As our research enterprise grows, we are also working to expand the broader scientific ecosystem in our region. Through the Roseman Bioscience Collaborative, we continue to engage local and state officials, economic development organizations, and industry partners to attract emerging research-driven companies to Nevada. The collaborative provides laboratory space, scientific infrastructure, and a supportive environment where startup companies can develop, test, and scale new discoveries. Master's-trained scientists play an essential role in research and development. Roseman's College of Graduate Studies supports the growing bioscience industries in both Nevada and Utah by training the workforce to help them grow and thrive. This work strengthens our region's innovation economies, creates opportunities for faculty and student engagement, and positions Roseman as a catalyst for expanding the bioscience sector in Nevada and Utah. As we expand our research impact and academic offerings, we also remain committed to ensuring that our programs lead to strong professional outcomes for our graduates. One important measure of that commitment is Roseman's consistently low student loan non-repayment rate. This year, the U.S. Department of Education issued new reporting on student loan non-repayment rates, reflecting how borrowers have managed their repayment obligations since January 2020. This national effort was designed to increase transparency, support student financial well-being, and encourage institutions to help borrowers remain in good standing as federal loan repayment resumed. Among the 26 institutions in Nevada included in the report, Roseman University had the lowest non-repayment rate at just 2%. The next lowest institution in the state reported a rate of 10%. When combined across Nevada and Utah, 69 institutions were evaluated, and only Roseman and 2 other institutions reported a non-repayment rate of 2% or lower. For the U.S. as a whole, of the more than 5,000 institutions surveyed, only 53 demonstrated comparable performance. This puts Roseman in the top 1% nationally. The result reflects more than responsible financial planning. It reflects program quality, student readiness for the professional practice, effective academic and career support, top-notch financial aid counseling services, and continued success of our graduates in the workforce. Our students are entering professions where they are needed, where they are prepared to contribute on day one, and where they are able to build stable careers that support their families and communities. This achievement is a shared one, made possible by faculty who prepare our graduates for successful practice, by staff who support students through their academic journey, by clinical and community partners who provide meaningful training environments, and by alumni who carry Roseman's values into their professional lives. Supporting student success also means ensuring that financial barriers do not prevent talented individuals from pursuing healthcare careers. The Hero Scholars Program, now in its 5th year, provides one-time scholarships to students. Hero Scholars are selected not only for their academic promise, but for their commitment to service, leadership, and community. This fall, we welcomed our largest class of Hero Scholars to date. Their journeys are diverse. Some have served in the military, others in emergency medical response, community clinics, behavioral health, research, or global service. Many have overcome significant personal and financial challenges. What they share is a deep desire to serve, to lead, and to improve the health and well-being of their communities. Since the program began in 2021, 48 Hero Scholars have received nearly $500,000 in scholarship support. These scholarships are made possible by generous donors, individuals, families, companies, and organizations who believe in the power of healthcare education and in the impact these students will make. We are grateful to all of those who support this program, including the presenting sponsor for the Roseman Hero Scholar Classic Golf Tournament, the Penta Building Group, whose multi-year commitment strengthens our ability to provide scholarships in the years ahead. Their partnership reflects a shared belief in creating pathways for future healthcare professionals to learn, grow, and serve. The Hero Scholar Program demonstrates the difference we can make when we invest in the next generation of healthcare providers. It reflects our shared commitment to helping students succeed today so that they may care for our communities tomorrow. Supporting students is one expression of our commitment to long-term community health. Maintaining institutional strength is another. In August, Standard & Poor's Global Ratings upgraded Roseman University's credit rating, distinguishing us as one of just 3 private higher education institutions in the nation to receive an upgrade this year. During that same period, 21 private universities received downgrades. This higher credit rating reflects disciplined financial management, responsible growth, and strategic investment in programs that meet regional workforce needs. It affirms that Roseman is not only stable, but well-positioned for long-term resilience and improves our ability to secure favorable financing for capital projects, supporting expansion of academic programs and investment in our students, our faculty, and the communities we serve. Roseman's financial trajectory, like the successes of our graduates, reflects a shared commitment to excellence, stewardship, and purpose. It is another example of how we advance together. As we look across these achievements, the growth of our academic programs, the expansion of clinical and community services, the development of new educational facilities, the advancement of research, and the strength of our financial foundation, a clear picture emerges. Roseman University is not simply growing. We are growing with purpose. Every step forward has been guided by the needs of the communities we serve and is shaped by the dedication of those who believe in our mission. Our work continues. The challenges in healthcare and education are real, and the needs in our region are great. But we do not face them alone. We face them together as faculty and staff, as students and alumni, as partners and supporters, as a community committed to advancing health and well-being. The state of Roseman University of Health Science is strong. It is stable. It is forward-moving, and it is prepared to meet the future with clarity and resolve. Roseman University's strength, stability, resiliency, progress, and innovation are grounded in our most valuable asset, our people. In the colleges of pharmacy, dental medicine, nursing, medicine, and graduate studies, and our supporting units, all faculty and staff work every day to deliver rigorous academic programs, support clinical care, guide research, and support students in their educational journeys. Their expertise, professionalism, and commitment form the foundation of Roseman University. Our students bring discipline, resilience, and a purpose to their studies. They are the reason we exist, and they are the future of our region's healthcare workforce. Our alumni, now more than 9,000 strong, contribute to patient care, public health, and health leadership in Nevada, Utah, and across the country. Their achievements reflect the solid education and core values of Roseman in action. Our clinical partners provide learning environments that prepare students for real-world practice and expand access to care in our communities. Our donors invest in our mission and help us grow programs and facilities that meet regional needs and provide scholarships to help our students achieve their dreams. Our board of trustees provide consistent leadership and strategic guidance. Together, we advance Roseman University and the communities we serve. I am grateful to all. Thank you for your continued commitment to Roseman University, to our mission, and to the communities we serve. Your partnership is essential to the work ahead, and we are honored to continue this journey with you. As I close today's presentation, I invite you to join us for our week of Thanksgiving, a week of giving that celebrates gratitude in motion, where gratitude meets generosity and every gift makes a difference. Beginning tomorrow, November 19th through November 25th, We'll turn thankfulness into impact, honoring those who teach, learn, and serve and heal through Roseman. Together, we'll transform gratitude into scholarships, opportunity and lives forever changed, because at Roseman, gratitude isn't just felt, it's shared. We will continue advancing together.